Thank you, Deep-Rive Clywyd. We talk a lot in this chamber about NHS waiting times and how they're the worst of all the UK nations. I feel, however, that the waiting times are just the tip of the iceberg and are actually the manifestation of many endemic faults in the Welsh NHS. I believe that ultimately most of the problems in the NHS in Wales are the result of the failure of the Welsh Labour policy in other areas, in particular education, and the fact that despite what Labour Cabinet Secretaries keep saying, policy and policy directions are not working in synergy. Since being elected, I've spoken with many NHS departments, cancer trusts, charities, hospices, and there's one prevailing issue, the lack of qualified staff in areas of diagnostics. As the Cabinet Secretary will know, there's a record shortage of physicists who are needed in radiation oncology, which has a massive impact on the speed of diagnosis, and there are also record shortages of workers in clinical engineering, who use medical technology to optimize healthcare delivery, design and develop and maintain medical equipment used to diagnose illness and to treat patients. Yet how does the Welsh Government respond to this? They get rid of the Triple Science Award, which is only going to intensify shortages in these areas for years to come. Getting rid of the Triple Science Award is an absolutely ludicrous idea that has been condemned by so many scientific bodies, and it is the Welsh NHS who are going to feel the brunt of this. What is so frustrating, Deep-Rive Clywyd...
Joel, with the intervention.
I did the equivalent of triple science, which was GCE, chemistry, physics and biology. Did you?
Oh, can you repeat that? Sorry, I only heard you when the mic came on.
I did the triple science, as it was then, which was GCE, chemistry, physics and biology. Did you? Well,
actually, I was advised against doing physics because my maths is terrible, so I did the others, though. Oh, well. Thank you. And it is the Welsh NHS who will feel the brunt of this. What is so frustrating, Deep-Rive Clywyd, is that Welsh Labour are either completely ignorant to this point, or much worse, they're deliberately doing it. It is truly bewildering that they cannot see this link. Like many other members in this chamber, I'm continually contacted by organisations who are appealing for national screening. Liver screening, audiology screening, lung screening, as we've heard today, to name but a few. But why don't we have this screening in place in the first place? It's because you need to have clinical nurse specialists in place to do it, who have had a proper science-backed education. Having these national screening programs would save so much work for the NHS, because it enables issues to be picked up early on, saving valuable resources by treating conditions in the primary stages, rather than trying to deal with more complex issues at the later stage. What Welsh Labour also cannot understand is that education policy is very likely deterring people from coming to Wales who could do these jobs. The poor PISA results in Wales does not just mean that Welsh children are being measured as having poor education outcomes. It also means that people who live elsewhere are probably not going to want to send their children to Welsh schools. Wales relies far too heavily on attracting an NHS workforce from elsewhere outside the country, and not having sufficient home-educated people to fill these roles is where a good deal of this problem lies. We also have to recognise that people in Wales are not looking after their health as well as they should be, and this is also a result of our poor education. Schools are just not being given the ability to encourage sports and activity because they're either having to deal with excess workloads, a lack of facilities, or more worryingly, a lack of money. I admit that this is not going to be for all schools, but I will argue a lot of schools meet this criteria. Imagine what could have happened had this Welsh Labour government accepted and backed my colleague Sam Rowland's outdoor education bill. A lot of these issues could have been addressed. The health of the nation is also the result of poor policy in looking after our environment. The loss of our much-loved urban environment, the loss of our much-loved green spaces, and as I mentioned, the continued pollution of our much-loved waterways and coastlands. Finally, we also have to acknowledge that the high waiting lists are an indirect consequence of overworked NHS staff. We've had COVID, and NHS staff have performed valiantly and gone above and beyond. However, there doesn't seem to be a let-up in the amount of work that needs to be done to recover the situation, and the Welsh Government are stubborn in their approach in helping. I've mentioned several times in this chamber about how private audiology can be used to reduce waiting times for hearing. This is done in England, Scotland, and in Northern Ireland. We do this for general practitioners, dentists and pharmacists in Wales. Yet the Welsh Government are refusing to allow this for audiology, which is a bizarre state of affairs, as it would dramatically improve outcomes for so many people and would not cost the Welsh NHS any money whatsoever. High waiting times in NHS Wales may be NHS Wales' problem, but it is far from their fault. It is the fault and fail of so many other Welsh Labour government policies. Thank you.